Well, today we're talking about mental health, and are we predetermined to struggle with it, or does our environment have a significant role to play?
Weighing in with us is Dr. Anthony Hutchinson. He is a university professor, a doctor of psychosocial clinical practice, an expert in youth violence, and an advisor at all levels of government. Wow, that's a lot.
That's a mouthful.
Welcome, Dr. Hutchinson.
And I'm trying to keep control of my mental health as I do it.
Well, welcome, Dr. Hutchinson. Let's talk about the impact of hereditary factors versus environment in our mental health. What are your thoughts?
Well, when we look at the issue of mental health, it's obviously a complex subject matter to address. But one of the things we do know is all individuals, we come, let's say, hardwired with genetic and biological predispositions to who we are. Now, the best evidence that we have from, say, the levels of the World Health Organization, Health Canada, can demonstrate from a statistical perspective that about 20 to 30% of who we are as people is generally within ourselves. But it's important to understand that when it comes to an issue of health, social environmental factors influence about 70 to 80% of our health outcomes as people at the population level.
So we don't have to just say my mom, if my mom had mental health issues, for example, then I might just feel like I can't escape it. This is in my genetic makeup. That's actually not true. A lot of it's in my control is what you're saying.
Well, a small percentage is within our control, but we know that the factors that impact us in terms of shaping our mental health outcomes at a population level are things outside of us that are social, environmental. And this is really important when it comes to the issue of stigmatization, for example. Stigmatization is itself an external influence on how we perceive issues of mental health. And so when we have what's called a social determinants of health perspective, or basically environmental factors that contribute to the health and well-being of people, we realize a lot of these things are external. So for example, some of the biggest drivers of health or mental health that impact people are things like stress. Well, stress is a response to what we as people experience in our lives, and then it impacts us at, let's say, the cognitive or the mental and even the physical level. There's been a plethora of studies at the epidemiological level or the population health studies level that show that when it comes to issues of stress, there's a direct correlation between increases in cancer rates, increases in heart disease, for example. And so this idea of stress, or even things like trauma, and the reality is, even though the statistic says that 1 in 5 or 20% of our population experiences mental health issues, the truth is the only people who may not experience mental health issues are people who are dead or perhaps while they're sleeping, although some people could have nightmares while they're sleeping, for example, and that's signs of perhaps trauma or so forth.
So if we put nature aside for a second, Doctor, what would you identify as the greatest environmental factors? I mean, you've identified stress as one of them, yeah, but some of the other factors that might contribute to our mental health wellness.
So again, there's numerous factors. For example, income and income inequality is arguably the most significant environmental stimulus that impacts people's health and well-being at the population level. It's a complex dynamic, but it's well documented in the scientific literature. So again, people that live in poverty have, for example, shorter life expectancies compared to people who maybe are more affluent. Educational factors, there's a correlation between education and life outcomes. Employment, it's not just about having a job, but the quality of the job, whether people have access to housing. And then another big one is the issue of social support networks. People who are better supported with loving, caring family members and friends generally have higher health outcomes at the population level compared to people who are isolated and don't have those same networks.
So we're seeing, mental health issues on the rise across this nation, especially with young people. A lot of these things are out of your control. Like, you may be born in a socioeconomic position where you couldn't get a lot of education, for example, or you can't get the job because you didn't get the education, all of those things. So how do we as a society help to diminish some of the mental health issues that we're seeing?
Well, it's important to understand that many of what we call the social determinants of health are factors that can be influenced by our government in terms of housing policy, income policies to make more fair distribution of wealth, educational opportunities, food security issues. All of these are under the influence of government, and there's a role for communities to play in this. So you look at things like a community food bank, or even the role of churches, providing places of inclusion where people can gather together. We know that, for example, churches are great foundations, or any religious institutions across our country are foundations where people can gather together, share, combat issues of isolation, meet people's needs. So there's a role for government. There's certain, but again, it's not just on the government. It's the role of community, and there's different places, factors that we can contribute to, just as everyday people. And if we engage in these things, we will actually see mental health, negative mental health issues go down. And it's important to distinguish between negative mental health and positive mental health, because there is such a stigmatization on this subject matter, which is why we're having our national awareness around this today. And so it's important to understand that one of the liberating factors of anybody who's experiencing these things, a lot of times it's not the fault of the person who's suffering from a mental health issue, but it's a factor of 3 to 1 on the influence on the person in terms of how strong the social environmental factors are on individuals.
Right, and you make a good point, because I was just going to ask you, do you think there's a danger for people that are struggling in the area of mental health, that they will feel blamed when we maybe overemphasize the environmental factors, and they think that, perhaps, oh, well, I've got all these environmental conditions ideal for a healthy mental state, but I'm still feeling off balance, and I can't really, we'll say, pull it together, if you will.
And again, everybody has biogenetic predispositions, we call them, or factors that we bring. But again, the best evidence shows that it's roughly about 20 to 30% of that we bring to the table, but most of it is what triggers a mental health issue. Simply stated, for a lot of people, we have, let's say, genetic predispositions to cancer, but we know that unless that cancer gene is triggered generally by things in the environment, things like stress or smoking or breathing in bad air, that gene may never become triggered to cause cancer in individuals.
Well, you mentioned, and it's great, about the role that communities play, that faith communities play. So talk to me about the role faith plays in mental health and how it can help.
Well, it's interesting. One of the factors of mental health that lead to it is cultural factors. And it's interesting, in the political realms, they talk about religion being a cultural factor, because governments regulate churches and religions to some degree. But the issue of faith is a different issue than religion. And I could argue that faith transcends culture. And we know that there's been scientific studies that show that people who pray have more favorable outcomes in terms of, if they're sick, they can recover quicker or better or more effectively. And so one of the things that we know is that there's a factor that when people have positive attitudes, or they believe strongly in their faith perspective, that their wellness improves. And if you're surrounded by people and community support networks that are of similar mind, we know that people's mental health can improve. Now, again, it's not to say that if a person has a biological condition that is adversely impacting them, let's say trauma, or there's a chemical imbalance perhaps that's occurring in the person's brain, then that's a different level. But one of the things we know is that at the significant level of a lot of our prevalence of mental health issues, social and environmental triggers are the culprit. It's not about a biogenetic predisposition that people bring. So it's not about blaming the victim. It's about emancipating people and saying, hey, what can we do as a society to show that we can help one another?
We're just about out of time, but we promised people some practical tips they can do today to improve their mental wellness. So can you give us some of those? One of the things we can do is, when we have people who are in isolation, it's about reaching out and engaging people, bringing them into community. Another thing is in terms of enhancing people's literacy. We get newcomers. We're a nation of newcomers. People come to Canada to start a new life, and one of the things that we can do is
reach out to them, and maybe they have English as a second language as a barrier. Maybe we reach out to them and encourage them to talk so that they can communicate in languages that where they can have better accessibility to services or programs. Or you know what, maybe it's just as simple as just helping out our neighbor. You know, the Bible says, love your neighbor. And you know, at the end of the day, that is probably one of the best interventions that we can have in terms of this mental health issue is love. Because for me, what us as clinicians do and doctors, we give interventions for these issues. But the truth of the matter is, when it comes, it's only God that can give transformation, and he does that through this act of love, and love, I would argue, is probably the most powerful antecedent to addressing a lot of our mental health issues in our society.
Well, that's powerful, Dr. Hutchinson, and I would like to encourage our viewers, perhaps you find yourself in a place of desperation and reaching out for help, and one of the things that you brought to our attention was the need for strong social network and social support. We would love to encourage you to call the number on the bottom of the screen, 1-866-273-4444, and someone will be on the other end of that line to pray with you. If you're perhaps struggling in this area, you're looking for support, you're looking for encouragement, we know a God that hears and answers prayer, and we would love to pray with you.
Yeah, you know what Dr. Hutchinson was saying, you don't have to do it alone. And thank you so much, by the way, for your perspective. We've loved having you. You really don't have to do it alone, and that's why we provide that resource for you. It's a sense of community in a sense. You can email or call in your prayer request. So I do hope you make that call. Well, as we've been talking about on this show, 2020 is the year of the Bible. Here's an excerpt from our documentary, The Bible in You. Take a look.